Right now, millions of older adults are taking medications that might be quietly damaging their hearts with no warning signs at all. And here's the most disturbing part. These aren't illegal drugs or experimental treatments. They are common, everyday medications sitting in medicine cabinets all over the world, prescribed by doctors, taken exactly as directed. Yet, cardiac surgeons and cardiologists are raising serious alarms. In operating rooms across the globe, they're seeing something that just doesn't add up. Hearts that should look fairly healthy for a person's age are showing severe inflammation, weakened muscle tissue, and dangerous rhythm disturbances. Again and again, when specialists trace patients' medical histories, they keep finding the same medications. And now, the research is finally catching up. Major studies from institutions like the Cleveland Clinic, Johns Hopkins, and the European Society of Cardiology confirm what doctors have been witnessing firsthand. Certain widely used medications are linked to measurable, documented heart damage in older adults. This isn't about rare side effects. Some of these drugs increase heart attack risk by more than 40%. Others double or even triple the risk of dangerous heart rhythm disorders. And most patients have no idea they're at risk. But one medication on this list stands above all the others. A drug cardiac surgeons are now calling the silent heart killer. Research involving more than 500,000 patients linked this medication to catastrophic cardiac outcomes, even when taken exactly as prescribed. The most shocking part, safer alternatives already exist for many of these. Before we reveal that number one drug, let us walk through the full list so you understand what could be affecting your heart right now. Coming in at number 7, we have proton pump inhibitors, or PPIs. Medications like Nexium, Prilosec, and Prevacid are among the most commonly prescribed drugs in the world. They reduce stomach acid and are helpful for short-term use. The danger begins when they're used long-term, which millions of older adults do. A major study analyzing nearly 3 million patients found that long-term PPI users had a 16 to 21% higher risk of heart attack. Researchers discovered these drugs may suppress nitric oxide, a molecule essential for keeping blood vessels relaxed and preventing clots. Lower nitric oxide means stiffer arteries, higher blood pressure, and greater clot risk. For many people, lifestyle changes or safer medications like H2 blockers may provide relief without the same cardiac danger. At number 6 are certain antibiotics. Some antibiotics save lives, but a specific class has raised serious concern. Fluoroquinolones, including ciprofloxacin and levofloxacin, have been linked to life-threatening heart complications. A study involving over 7 million patients found a 66% increased risk of aortic aneurysm and dissection shortly after use. These drugs can also disrupt the heart's electrical system, triggering dangerous arrhythmias, especially in adults over 65. Health authorities now recommend using these antibiotics only when no safer alternatives exist. Next, at number 5, are NSAID pain relievers, drugs. like ibuprofen, naproxen, and celecoxib are widely used for arthritis and chronic pain. For older adults, long-term or high-dose use can significantly raise heart attack and stroke risk. A massive review of over 350,000 patients found certain NSAIDs increased cardiovascular events by 30 to 40%. These drugs raise blood pressure, increase clotting risk, and strain the heart, sometimes within just days of use. Topical treatments, physical therapy, and alternative pain strategies may offer safer relief. Number 4 on our list, older diabetes medications. Some diabetes drugs are great at lowering blood sugar but can quietly raise heart risk. Certain sulfonylureas have been linked to higher rates of heart attacks and cardiovascular death compared to newer medications. In contrast, many newer diabetes treatments have actually shown heart protective benefits. For older adults, controlling blood sugar is important, but protecting the heart is absolutely essential. Moving on to number 3, sleep medications. Insomnia is common in older adults, but some sleep drugs carry serious cardiac risks. Prescription sleep aids and benzodiazepines have been associated with increased mortality, including heart-related deaths. These drugs can worsen sleep apnea, suppress breathing, increase fall risk, and stress the heart. Non-drug approaches like cognitive behavioral therapy for insomnia, good sleep hygiene, and low-dose melatonin are often safer and more effective for long-term use. At number 2, we have antipsychotic medications, often prescribed for agitation or behavioral symptoms in older adults. These drugs carry what's known as a black box warning from the FDA, its most serious alert. Large studies show a twofold increase in sudden cardiac death among elderly users. They can affect heart rhythm, blood pressure, metabolism, and the body's automatic functions. Whenever possible, non-drug strategies should be the first approach to managing these symptoms. And now, the number 1 medication on our list. What some cardiac specialists are calling the greatest medication-related threat to the hearts of older adults: prescription opioid painkillers. Drugs like oxycodone, hydrocodone, morphine, and even tramadol can dramatically increase cardiovascular risk. A study of more than 575,000 adults over 65 found that long-term opioid use raised the risk of cardiovascular death by a staggering 65%. How these drugs can reduce oxygen levels, disrupt heart rhythm, increase inflammation, and weaken the heart muscle over time. Even more concerning, combining opioids with other common medications can multiply the danger. Now, let's be very clear. This video is not telling you to stop your medications. It's telling you to ask better questions. Medical knowledge evolves, and as patients, we deserve to evolve with it. Many of these heart-related complications are preventable with awareness, safer alternatives, and informed conversations with your healthcare provider. So here's the real question. After watching this, will you talk to your doctor or pharmacist about your medications? It's your health, and you are your own best advocate. Share your thoughts in the comments below. Your experience and your questions might just help someone else protect their heart. Thanks for watching, and please consider subscribing for more content that empowers you to take charge of your health.